We would like to welcome you to the PSI National Practical Test. Electronics of any kind are strictly prohibited in the testing facility. Please raise your hand if you have any of these restricted devices in your possession so we may address your situation. If any test taker is found possessing any prohibited items in the testing facility, PSI will stop your test and you will be required to leave the testing facility immediately, and a report on your actions will be submitted to your governing authorities. Test takers are responsible for providing all necessary equipment and supplies needed for the performance of their practical test. Test takers are not permitted to assist other test takers in any way. Test takers are evaluated at all times throughout the test for public health and safety. If you have an emergency or need to use the restroom during the test, please raise your hand for assistance in leaving the testing area. You will be required to sign out and sign back in when returning. Keep in mind the time will continue to elapse and any instructions you miss will not be repeated. Only one test taker may leave the area at a time. Please return as quickly as possible. The prompter will read instructions for each topic area, and the evaluator will facilitate the timing for each topic area and supervise the test. You are not allowed to speak or ask questions pertaining to the test content. A certified practical evaluator is responsible for observing and scoring test takers' performance, and is not allowed to converse with test takers except to provide instruction when required in specific demonstrations within the topic areas. You are each provided with a red book to read along with the instructions in your language. Please do not touch or turn the pages in the red book, however, feel free to reread the instructions for the topic as needed to understand the tasks. Evaluators are only permitted to answer general questions that are not directed to the test content. Are there any questions about the instructions you have been given?